Hello, thank you for watching my Baby Stats channel. If you like my videos, please remember to subscribe and press on the doorbell so you'll get notifications when new videos are released. Thank you. Today, we're going to continue our last talk about preterm births. If you remember, last time we talked about the latest study record from the WHO, World Health Organization. There are 15 million babies born too soon each year in the world. About 1.1 million preterm babies die every year. But with inexpensive treatment, 75% could have survived. So here is a question. What can we do to prevent preterm births? This is the topic of today's video, and I will explain to you in details. First, let's look at the WHO report again. It tells us that there are two categories to define preterm births. Some preterm births are spontaneously from early onset of labor, which means there's no external force to cause the preterm. But some other preterm births are premature rupture of the membranes, which are provider-induced. In other words, from external force. So when will the provider-induced early deliveries happen? The WHO report gave us 3 scenarios. First, when the health of the mother is in jeopardy, or when the health of the fetus, the baby-to-be, is in jeopardy. For example, when there is complications such as dangerously high blood pressure in pregnancy. Also, in other cases, provider-induced early deliveries may happen for convenience of the doctor, for convenience of the midwife, or for the mother. Or even by an error in due dates. So a very unfortunate fact is, even babies born just a few weeks too soon are more likely to be sent back to hospital or to have breathing problems or other illnesses. For the details of this, you can please refer to the last video I published, and I put a link underneath this video. Now you may want to ask, how do we reduce preterm numbers? According to the WHO report, a key way to reduce preterm numbers is to find methods to help all pregnancies go to full term, or 39 weeks. This is very obvious, but how do we do that? Experts are now looking closely at what can be done before a woman gets pregnant to help her have an optimal outcome. We have some hope to addressing this important topic because several risk factors for preterm births have been actually identified. The report says a woman is at higher risk of having preterm babies when the following applies. 1. Prior history of preterm births, which means women who already had preterm birth experience will unfortunately have higher chance to have another preterm birth if she is pregnant again. And 2, other factors: underweight, and then obesity and diabetes, and then hypertension. Of course, smoking is not good. Infection. Also, we look at the ages of getting pregnant too early, which means under 17 years old, or in opposite, getting pregnant too old, which is over 40 years old. Then there are factors related with genetics, multi-fetal pregnancy, which means having twins, triplets, and even more babies at one time. Then the last but not least, when we have pregnancies spaced too close together. Okay. Now we know about the key risk factors. Doesn't mean one risk factor is heavier than the other, so we can potentially somehow prioritize them so we can treat them better. The answer is unfortunately no. It's not very clear. So it is not clearly researched at this moment. According to the WHO report, little is known at the interplay of these and other environmental and social factors. We definitely need more clear identification of the risk factors and understand how they interact with each other and how that interaction may lead to preterm births, so that effective methods and treatments can be done better to prevent the problem of preterm births. It sounds so disappointing, isn't it? However, fortunately, the WHO report does have some advices for things that we can do, which is called effective measures. These include: first, screening women for known medical conditions that could put them at risk during pregnancy, and making sure pregnant women will get good nutrition before, not just during, but before and during pregnancy. And also, assuring all women have access and know how to get access to good preconception and prenatal health care. Plus, receive a recommended number of visits during pregnancy. It's so important to not skip recommended number of visits. Do that as much as you can. There are indeed a lot we can do. So let me ask, if you are pregnant or you are preparing to be having a baby soon, do you now feel a little more confident to have a healthy and full-term baby after watching this video? Just in case you need more information, I also researched at the CDC's database. CDC means the US Centers for Disease Control and Prevention, for people who don't know. So according to the database in CDC, for example, the preterm birth rate declined about 1% in 2020 from 2019 because they introduced some strategies to hopefully reduce the occurrence of preterm births. So CDC introduced 5 groups of strategies. A few of the CDC recommended strategies are the same as what we mentioned in the earlier section of this video, but I have filtered that out for you, while the following rest of the strategies can be found as useful for cases that can be applied to. So one strategy from CDC is to discourage non-medically indicated deliveries, especially before 39 weeks. And then another CDC recommended strategy for reducing preterm birth is preventing unintended pregnancies and achieving optimal birth spacing. So the first one means if it's not medical indicated, especially before 39 weeks, CDC discouraged that delivery to happen, according to CDC and the WHO report. Then, the second one CDC recommended to prevent unintended pregnancies. According to CDC's database, nearly 3/4 of teen births are intended, and these pregnancies are at 17% higher risk for pregnancy, preterm delivery. So regardless of a woman's age, having access to the full range of contraceptive methods is so important to prevent unintended pregnancies. The fifth strategy that was recommended was using assisted reproductive technology to transfer a single embryo to reduce multiple births and the risk for preterm birth. Do you know in 2013 it was estimated that assisted reproductive technology contributed to 18.7% of multiple births, 4.6% of preterm births, and 5% of very preterm births, according to CDC. So during the last 2 sessions of my videos, we talked about preterm births, and the intention of me making these videos is to bring attention from parents to be, families of new babies, and all related social factors that are indeed things that we can do to help. Thank you for watching. See you next time.